The preparation that Findlay students get here is very, very good. By the time the end of their rotation, they are well prepared to practice as a pharmacist and as a clinical pharmacist in many different settings.
One of the things that we know is that some students have had an internship experience and some hadn't had an internship experience within a hospital setting. So this particular rotation, I think, allows students to get that global aspect of being within a hospital setting. So more than just interacting with the pharmacy colleagues, but also that interaction with nursing and physicians and so forth. And so I think some of the basics of how to dispense a medication, how to interpret medication orders, what to look for, are really key aspects for students to have going out of school, especially if they're not going to do residency and they still want to work within a hospital setting.
I think the clinical experiences on rotations help to prepare the students for their career by having the opportunity to interact with the medical team, a variety of personalities and opinions, learning how to bring up a recommendation in a way that's collegial, and then working with the group to find a solution that works best for the patient.
So I feel that this clinical experience here at Blanchard Valley prepares them for the working world in multiple ways. It really gives them the opportunity to work with patients and really do those aspects that they're going to do as a pharmacist. But I also like it here at Blanchard Valley because if they see how the clinical functions work at a smaller hospital, they can really apply that to another small hospital, but also to a larger hospital. We also try to introduce some ideas and concepts of patient communication and interactions that they can apply if they were going into a retail setting. So really we try to polish the student to whatever their future is going to be.
We found that the students from the University of Findlay have been well prepared for their clinical experiences, especially in the area of literature evaluation. We've been very impressed when doing journal clubs with those students.
Along the way, I think most of the students come on site very prepared, very professional, eager to learn, ask a lot of great questions. The preceptors from or the instructors from the university that have come on site have been very professional, very enthused and excited to partner with Ohio Health Riverside to develop their students along the way. So,
pharmacy students that are coming in for rotations are very well prepared, very impressed with their overall knowledge. Just like any students coming in though, they still need that little opportunity to polish, and that's really what we take pride in here. They know the bookwork stuff, but now it's really getting that hands-on type responsibility.
The growth is phenomenal. They come sometimes very hesitant, very unsure of themselves, and by the time at the end of the rotation, they're very confident, able to practice in a community or institutional setting.
So the University of Findlay already does some on-campus interactions with patients and hands-on experience. It does give a little bit of advantage, but a lot of it is still kind of staged. So there's something to be said about that real-world, thinking on your feet type experience. So what I like about being a preceptor and why I continue to do this is really it gives me the opportunity to give back to the profession of pharmacy. Somebody had to be my mentor and somebody had to be my preceptor. So really I feel that there's a professional obligation to do that same thing. Also, I'm not going to lie, the students really keep me fresh and really keep me up to date when it comes to what's current practice and items like that, because they're questioning all the time of why do we do this, or this is what we learned in school, how does that apply to real world? So I have to be able to answer those questions. So it's two reasons right there.
The thing I like most about being a preceptor is sharing knowledge with the younger generation and the students coming up, and will be the next generation pharmacists helping patients out.
One of the things I like most about being a preceptor is the students, one, allows me to stay on my toes, so they ask a lot of interesting questions that some of the times I may not have thought about, so it allows me to kind of research my own and kind of continue to sharpen myself.
I think for me, the thing I like most about being a preceptor is that the students challenge me every day, and I feel like I learn something new. I might think that I'm very familiar with a topic, but then they might ask a question that causes me to need to look into something further as well.
So another aspect of being a preceptor is that it allows me to give back to the profession. I can remember when I was a student as well as a resident that I had some really great preceptors that helped to groom me along the way to really massage my clinical knowledge base. And so giving back is one of the ways that we continue to foster really strong clinicians that come through. I'm able to share with the students some of the things that I learned by trial and error and mistake, and hope that they will excel where I kind of left off at. So that is another great aspect of being a preceptor.